All right, welcome to The Explainer. Today, we are diving headfirst into a really high-stakes countdown in American healthcare. I'm talking about a deadline that's just around the corner, one that could make health insurance totally unaffordable for millions. And the crazy part? Washington seems to be at a complete standstill. So, let's break this down.
So let's just get right into it. Could your health insurance premium double next year? I mean, this isn't just some hypothetical question to get you thinking. For over 20 million Americans who get their insurance on the ACA marketplace, this is a very, very real possibility as a critical deadline gets closer and closer. Yeah, you're seeing that right. 114%. According to the Kaiser Family Foundation, that's the average premium increase people who get subsidies are looking at if Congress just does nothing. And honestly, for a lot of folks, the actual jump could be way, way higher. Okay, so what is this deadline? What's this healthcare cliff everyone's talking about? Well, it all comes down to the expiration of a really crucial program, a program that's been keeping insurance affordable for a record number of people. They're called Enhanced Premium Tax Credits, or EPTCs. And basically, these are federal subsidies that cap what a family has to pay for health insurance at 8.5% of their income. It's a huge deal. These were put in place during the pandemic. They've been extended since then. And honestly, they are the only thing standing between millions of families and that potential 114% price hike. They got rid of what was called a subsidy cliff, where earning just $1 extra could mean you lose all your financial help. If these expire, well, that cliff comes roaring right back. Now, here's where things get really interesting. There's this huge disconnect between this legislative cliff we're headed for and what Americans actually say they want. It's like the debate happening in Washington is in a completely different universe from what people are talking about at their kitchen tables. Just look at this number, 66%. According to Pew Research, a solid 2/3 of Americans, we're talking a real supermajority here, believe the federal government has a fundamental responsibility to make sure everyone has health coverage. And this isn't some new thing either. This has been the majority opinion for a long time. But here's the paradox, right? This is the core tension. While pretty much everyone agrees on the goal, let's get people covered, they are deeply, deeply divided on the how. I mean, the country is split almost perfectly between wanting a single-payer system, a mix of public and private like we have now, or a much more limited role for the government. And get this divide cuts right through the political parties too. And this part is fascinating. A full 60% of lower-income Republicans say the government is responsible for coverage. That flies directly in the face of their party's official platform and shows this huge gap with wealthier Republicans. It really suggests that for a lot of people, their personal financial reality is starting to matter a lot more than their political ideology. So with that deep division as the backdrop, how is Washington even trying to solve this thing? Well, as you might guess, we're seeing two fundamentally different paths emerge, and they reflect two very, very different philosophies about healthcare. On one side, you have the Democratic proposal, and it's pretty simple. Just keep the current system going, a clean 3-year extension of those enhanced subsidies. But on the other side, you've got the Republican proposal, a bill called H.R. 6703. And their goal is to fundamentally change the market itself, to try and lower that sticker price on insurance. Okay, so the Republican plan has this, well, it's a counterintuitive twist, so let's walk through it together. First, the government would start paying insurers directly for certain discounts. Because of that, insurers wouldn't have to inflate their prices anymore, so the official sticker price of some insurance plans would actually drop. Now, that sounds great, right? Lower prices? But here's the paradox. The subsidies that people get are tied directly to that sticker price. So if the sticker price goes down, the value of your subsidy also goes down. The bizarre result is that some low-income families could actually end up paying more out of pocket. It's a real head-scratcher. And this really brings us to the core philosophical battle at the heart of this entire debate. It's that classic conflict. Do you prioritize comprehensive protection for everyone, or do you prioritize offering more consumer choice? Patient advocacy groups like the American Cancer Society are really sounding the alarm on this. They argue the Republican bill would open the door to what they call junk insurance, plans that can get around the ACA's rules, maybe by not covering things like specialty cancer drugs. Their whole argument is that these plans create loopholes to avoid covering sick people, which kind of undermines the entire point of having insurance in the first place. But supporters, on the other hand, they see it very differently. They argue that the ACA's rules are way too rigid and expensive. They believe these new, more flexible plans would offer tailored, more affordable choices, especially for small businesses or self-employed folks. People who feel like they're being forced to buy these super expensive plans with benefits they'll never use, like a 55-year-old man having to pay for maternity care.
So what happens when you have two completely opposing ideas on the table and a deadline that's breathing down everyone's neck? Well, you get what we have now. Washington is locked in a high-stakes political game of chicken. The pressure from back home got so intense that some Republicans who are hearing from their own constituents about these massive potential price hikes basically decided they couldn't wait for their party leadership to figure something out. And so you had 4 moderate Republicans who actually broke ranks to sign a Democratic discharge petition. Now, that is a really rare move in Congress. It's a procedural tool you use to go around party leadership and force a vote on something. And one of them, Representative Mike Lawler, he didn't mince words. He called his own party's refusal to act political malpractice. But here's the thing. Even with that little rebellion, the whole system is just jammed. The House passed the Republican bill, but it's completely dead on arrival in the Senate. And the Senate can't pass a clean extension because of its own procedural rules, like the filibuster. So with both sides totally dug in, doing nothing has become the most likely and honestly the most dangerous outcome. Okay, so what does all this political gridlock actually mean for real people's wallets if that clock runs out? Because these numbers, they are not abstract. They are very, very real. I mean, the impact is just staggering. And it hits hardest in rural states where healthcare is already more expensive. Take a 60-year-old couple in Wyoming, making about $85,000 a year. Their monthly premium would skyrocket from around $600 to nearly $4,800. That's a nearly 700% increase. We're not talking about an inconvenience here. For most people, that's just an impossible cost. And what's the national consequence of all those individual price shocks? While the Congressional Budget Office projects that 4 million people will become uninsured almost overnight, it would just erase years and years of progress in getting more Americans covered. Which, of course, leaves us with this final, unavoidable question. You have a clear public mandate. People want the government to ensure health coverage. But you also have a political system that seems totally incapable of preventing a crisis that's going to hurt millions of its own citizens. The abstract debate over policy is about to collide head-on with the harsh reality of family budgets. And that's going to force a decision, one way or another.